Do you get tons of advertisements for breastfeeding specific clothing and wonder if it's really worth spending that much money to get access to your breasts? Well, I have some thoughts about this. And even though breastfeeding clothing isn't specifically outlined in my scope of practice, I see a lot of people who use breastfeeding clothing, and I myself did use breastfeeding clothing with my second child. And so I have some thoughts about when breastfeeding clothing is great to use and when it can actually impede your breastfeeding relationship and your milk supply. So let's get into it. When I began breastfeeding, I was blindsided by how difficult it was. Having known only a handful of people who had ever done it and only seeing it up close a couple of times, I had a huge learning curve. Since then, I've become a doula, a childbirth educator, and an internationally board-certified lactation consultant, or an IBCLC. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore the systemic, medical, and cultural barriers that make feeding our babies so difficult, so that you know your baby feeding struggles are not your fault, and your triumphs really are the miracles you feel they are. I just want to preface this episode by saying the reason something like breastfeeding clothing even exists in the first place is because we live in a society that is very uncomfortable with women showing their bodies, especially when we're feeding babies. So if we were to go to the beach and my husband and I were both there, he could go topless and I could not because his nipples are not salacious, but mine are. Even though I need to expose my nipples to feed babies, and he does not when I was breastfeeding. The other part of this is that we are not supposed to look as if we have had babies. And so many of us, myself included, feel as if we cannot lift up our shirts and leave our breasts covered because we do not want our postpartum tummies being shown, because our postpartum tummies don't look like our pre-baby tummies. And so I know I've had many conversations with many women over the years, and many people have said, I actually don't mind showing my breasts. It's showing my tummy that bothers me. But either way, this comes from a culture that is uncomfortable with women showing their bodies. Now, there is no shame to any individual who says, okay, so this is a cultural expectation. I am not going to single-handedly change this expectation, nor do I feel comfortable doing so, and I want to be covered up. And so then the question is, what is the best way to do that? And there's not going to be one right answer to this. Some people choose to use nursing covers if they want to cover up. And for me and for many other people, this is the most cumbersome way to cover up while feeding a baby because, first of all, you have another item that you're carrying around. And secondly, many babies don't like to be covered. And thirdly, especially in the beginning, when you are learning to breastfeed, and I'm saying this from a clinical perspective now, when you have something that is in the way of you and your baby, and you are trying to crick your neck and look down into the cover to make sure that the baby's position is right and that their hands are in the right place and that their chin is coming to the breast first and that they're opening nice and wide. It is really hard to do that with a big piece of cloth surrounding the baby, no matter how thin that cloth is or no matter how big of an opening there is at the top so that you can see down into it. It just provides one extra layer of difficulty to a situation that for so many people can already be difficult. If you want to have less anxiety and more confidence so that your parenting journey can feel like you always wanted it to feel, then go to my website right now so that you can have a person by your side who not only knows how you feel, but who combines my expertise of lactation with your expertise of your body and your baby to help you make the next right step in your lactation journey, because that's all you really need to do is make the next right step. And right now, that next right step is going to my website, www.quavinbirthservices.com. And I can't wait to see your name pop up in my inbox or on my phone, on my text messages. Talk to you soon. And so then that brings us to the next option, which is breastfeeding specific clothing. And this is clothing that either lifts up, it has like a flap that lifts up, or that you pull it to the side. Sometimes there's even like a little zipper that you can unzip. And I will say that once breastfeeding was well established, I did find this type of clothing pretty helpful to wear when I was out and about with my child, especially in the winter. And I wanted to have warm clothing on that also allowed easy access to my breasts to be able to feed my baby. I find that pretty ingenious that this type of clothing exists. However, there are a couple of caveats that I would like to share. The first, and I mentioned this in another episode when I talked about 5 uncommon tips for successful breastfeeding in the hospital. I can link that in the show notes. But the first is that when you go to the hospital and you are giving birth to your baby, and then you are in those early postpartum days and weeks, breastfeeding clothing is just not appropriate. It often gets in the way more than it is helpful, because you really do need to be able to see your full breast. You need to figure out how much of your specific breast your baby's mouth needs to take in to be able to have good milk transfer and to not have very much pain. You're figuring out positioning, and the more skin to skin you do in those early days and weeks, the better it is for your milk supply. And so if you are wearing breastfeeding specific clothing, which is meant to cover your body, by default, you will not be engaging in skin to skin with your baby. You will have cloth between you and your baby. And skin to skin during the first weeks creates a hormonal response for both you and your baby that allows your baby to nurse better. It releases the hormones that signal to your body to both produce milk and to release the milk and to relax during that engagement of breastfeeding. And so I encourage people to take off the nursing specific clothing when they are at the hospital. And I would say until you feel like you can breastfeed anywhere and everywhere in any position in your home in particular, not to put it back on. And in those early weeks, while you are still recovering, while you are still bleeding, or while your C-section incision is still healing, to really focus on the skin-to-skin time. And of course, there are exceptions, right? If you're going to a doctor's appointment, it makes sense to throw on some nursing-specific clothing. If you have, some family coming over, and that doesn't happen super frequently, then of course, throw on that breastfeeding specific clothing. But remember that those early weeks are so important for establishing your milk supply that skin to skin time is really going to be helpful. You've heard me now for a few months talking about how much I've enjoyed getting home cooked meals delivered right to my front door from feastandfettle.com. And I'm here today to tell you that if you know somebody who is in the postpartum period, who you would like to provide true support to, that you should go to feastandfettle.com and order home-cooked meals to be delivered right to their front door. One of the biggest barriers to breastfeeding success is a lack of support. A new parent is feeding a baby up to 15 times a day. How on earth do we expect that person to feed that baby that many times, also feed themselves, and provide meals to other members of their family? There's not enough time. You know how hard it is as a busy parent yourself to try to put meals on the table. Go to feastandfettle.com, use my code MILK, MILK, coordinate which meals they would like to have delivered, and send them a week's worth of delicious meals. And be the person who eases the burden for them. What a gift. I can't think of a better way to support somebody in the postpartum period. And then to piggyback on that, once breastfeeding is established and you feel like, okay, I've got this, I can do this in a variety of positions, I feel comfortable taking my baby out, I can breastfeed on a park bench or seated at a restaurant, and I can breastfeed in other people's homes, and I really feel like this is second nature. And then you start transitioning to wearing more of the breastfeeding specific clothing while you're with your baby. I would give the caveat that when you are at home, continue to wear clothing that allows you to be skin to skin. Because the importance of skin to skin does not just go away after the first few days and weeks. It continues to be an important part of maintaining your milk supply, increasing your milk supply when needed, helping your baby to relax, helping you to feel settled, providing those good sleep hormones at nighttime for both you and for the baby. And so making sure that at the times when you are at home and you are settled in with your baby and you are relaxed, that the breastfeeding specific clothing comes off, and clothing that you are able to open up and touch your baby's skin with your skin on a regular basis is something that you are wearing while breastfeeding your baby. I can say that in my practice, especially in the hospital, I really see people struggling when they're wearing the breastfeeding specific clothing. I think it serves a purpose. I think it is a pretty ingenious idea, but I think there's a time and a place for the breastfeeding clothing. And then there is a time and a place for us to snuggle up with our babies, feel each other's skin, and allow those hormones to flow and not let the clothing get in the way. And then, of course, there are people who don't want to invest in the breastfeeding clothing. And there are all sorts of things that you can do so that you don't have to pay tons of money for a shirt you're only going to wear during the breastfeeding period. And lots of people like to layer up. So maybe like a nursing top that you can unclip with a t-shirt on top, or a button-down shirt is like a great go-to just to be able to expose one breast, and then you can pull your bra on top and the breastfeeding and the button-down shirt above, or just layer, so a t-shirt underneath and a button-up on top. There's lots of ways to do this so that you feel comfortable. Your body isn't very exposed, yet you're not having to pay a bunch of money for nursing clothing. So I would love to know if you used a ton of nursing clothing, and if so, what were your favorite brands? What did you really like about it? Did you find any used nursing clothing sources? And the way you can tell me about this is by going onto one of my social medias, all linked in the show notes, Lo Nigrosh IBCLC. You can find me there, TikTok, Instagram, and you can also find me at my Milk Making Minutes community group on Facebook, where we discuss the barriers like using breastfeeding clothing from the very beginning in the hospital to human milk making, so that one by one we can chip away at those barriers. And that is for both perinatal professionals and for parents. And with that, If you know somebody who is about to be a parent and you're looking for a way to really show your support to them in the postpartum period, why not go to feastandfettle.com and get $30 off your first order of meals shipped right to their home and show them that they can relax during the postpartum period. They don't have to do it all. They can let somebody else do the cooking for them. They'll love it. You'll feel good about supporting someone. It's a win-win situation. Bye.